It's getting those electronics home, so much fun. All right, let's talk about another item, which is, it's important. It's important, of course, to know what's going on inside of our own bodies. We want to be healthy. We want our families to stay healthy. How often do you get your blood pressure checked? A lot of us, it's once a year when we go to the doctor, and heaven forbid we find out that something is wrong that we didn't know about. Well, you no longer have to worry about maybe going to a drugstore and sitting down in that big machine with a big cuff and having that determine what your blood pressure is, because now the technology is portable and it's small enough for us to have in our homes. This is the Veridian Health, a slim design wrist cuff blood pressure monitor. So it's $5 off today. You're getting it home for $10 on Flex with free shipping and handling. So basically for $10, you're gonna have this little computer that you are going to put on your wrist as often as you need to check your blood pressure and have a complete rundown of everything that's going on in your home. So easy. It's easy to use. It's got an extra large LED screen. The push of one button tells you what your blood pressure is. 2 people can actually use this. So if you're getting this for you and your spouse, you both can use the same system. And then it stores 30 days worth of results for those 2 people. So if you want to take this as more or less your health record to the doctor with you, that's brilliant. I mentioned you're getting this home on Flex for $10 with free shipping and handling. You have 2 colors. You can pick this up in white, or you can pick this up in purple. It does come with the great storage case as well, but notice it's small and compact and so easy to take with you. Nurse Matt Peters is joining us to tell us all about how easy this is to use.
Hey, Carrie, how are you?
I am good, thank you.
Good, excellent. I always tell everybody needs a blood pressure monitor at home. It's very important. Yeah. All those features that you mentioned, Veridian is great at. What they've done with this unit, though, is actually incredible. This is it. This is the unit right here. It can actually fit in your pocket. It's very discreet, and it addresses a couple of concerns that a lot of my patients have. If I take out the unit here and show you, it's a very slim design. A lot of patients have trouble balancing some of the wrist monitors on their wrists and actually fastening it. So check this out here. I'm gonna open this up here. It actually has a cuff that's already pre-attached, so you can actually just hang it from your wrist, pull the loop into position, and fasten it.
Oh, so you don't have to put it on the table and try to balance it? Oh, that's perfect.
So it's perfect.
Okay.
Also, it's clinically accurate, which in the medical world, if it's not clinically accurate, what's the use in having it? So what I want to do is, I want to show everybody just how easy it is to use. I'm going to come around the other side for you.
Okay, should I take my bracelets off here?
No, that's it. If you push them up, we can do it that way.
Okay.
So what you want to do is just insert your hand through there.
Okay.
And I'm gonna hold it in place. And with any wrist monitor, you wanna hold it at the level of your heart.
Okay.
Okay, just like that. One button gets it started, and just like that, it's gonna go and give us a reading. So while that's cycling, I just want to address how important high blood pressure is in the country. It's a huge epidemic. About 70 million adults in this country have hypertension. That's 1 in 3 adults. So we actually, every one of us knows somebody who has hypertension, and we call it the silent killer for a reason. We don't know that we have a problem until something actually happens, like a heart attack or, God forbid, a stroke. Another 70 million adults actually has pre-hypertension. So undiagnosed, kind of under the radar, we don't know what's going on. And $46 billion is what this costs us in this country. So you're missing work, you're paying for medications, it's hospital stays. Yeah, it's frightening. So, all
right, how am I doing?
Just like that, we have a reading. And I want to take this off and show everybody just how much information you actually get from this.
It's really comfortable, by the way.
Yeah, it is. It's extremely comfortable. And this cuff actually fits a variety of sizes of wrists. You can pull it very snug. As you can see, it's very comfortable. So what we have here in this reading, look at all the information. We have our systolic blood pressure, diastolic blood pressure. Down here, we have your pulse. And what it's going to do, as you said, we can store up to 60 readings in memory for 2 users. So you and your loved one can share this unit, and it holds up to 60 units a piece, 60 readings a piece for you. So it's going to time and date stamp that. Because what you want to do with blood pressure, Carrie, is you want to get a trend. You want to check it the same time every day. Bring that information into your healthcare provider so that if there's an issue, they can treat it. Because
a lot of times you go to your once a year physical and your blood pressure is elevated, and they don't know, well, is it elevated because you're here, you know? Or do you really have a problem? So I love that you can monitor it over, you said 60 days, it saves 60 of them?
60 readings, right. So that's a couple months worth of information. And we call that white coat syndrome. We go to the doctor, our blood pressure is elevated, and it's not elevated all the time necessarily. So one reading doesn't actually give us a full picture of what's going on inside our body. This unit holds so much information that our providers can actually treat something and see the trend over time.
I think that's so smart. I mean, if there is something that is so affordable and compact and something that we all should be monitoring, and we'll show you those statistics here in just a moment again, to know what your blood pressure is doing, to know what's going on inside of our own bodies. I mean, it makes sense to do it. To know not just once a year, maybe if we actually go to our physical once a year, to know all year what is going on. So if there is a problem, we can address it. Here's the thing, we have 2 colors for you to choose from, and you basically, it's the color of the case, because you get the case, it's compact, you can put it in your pocket, you can throw it in your handbag. You get the heart rate monitor, but then you also get, or excuse me, the blood pressure monitor, but then you also get either the case in the purple or the white. It comes with a lifetime warranty. It takes AA batteries, and the batteries are included with your purchase as well. If you can get this home now with our extended holiday return in place, which means you have until January 31st to decide if you're going to keep it, get this home now and try it between now and then. Log your results for 60 days and see what your blood pressure is doing. Or maybe that's somebody, a mom, a dad, a grandma, someone in your family that you love, especially if you have high blood pressure running in your family, which I do, Matt. It's, you know, so important to do that we definitely recommend it. It's $10 on Flex for you to get this home. So what you got going on now? So
many of us do, and I just want to show everybody, look how nicely this actually fits over Jen's wrist. When we pull this snug, a lot of my patients, like I said, their concern is that it doesn't fit snugly on their wrist. This unit fits very well. So it's a comfortable fit, 1 button to get it started. And, you know, you're talking, Carrie, about we don't know what's going on inside our bodies. If you don't actually have the information at hand and know what's going on, you can't treat anything. My mom had a heart attack a few years ago. We didn't see it coming because she didn't check her blood pressure on a regular basis. And she couldn't feel any signs or symptoms because high blood pressure really doesn't come with any signs or symptoms necessarily. Exactly. So once, I mean, thank goodness she's okay today, but once we figured that out, she's checking her blood pressure on a regular basis. It also, you know, prevents people from getting over-medicated because, like you said, your blood pressure is elevated in the doctor's office, and if you don't have that trend and the accurate picture over time to see what's really going on, then it leads to sometimes improper medication. And I love that this one is just so darn easy to use. With the new redesign of the strap, you're not having to put it on your wrist and then put your wrist kind of down on the counter to get it to stay. It stays already kind of pre-looped, if you will, and then you can adjust it to your size wrist, so it's going to fit multiple size wrists to get that perfect fit. And then you've got a nice large LED easy to read screen. You push 1 button and it does it all for you. Within a few seconds you get a complete readout, and then you can take 2 people, by the way, so I'm going to use this, Matt's going to use the exact same one, and it's going to save 60 readouts from me and 60 readouts from you to be able to take to your doctor. I mean, knowledge is power. That's huge. Right, for each of us. And just to show everybody again, this is a great feature, and the Veridian units all have this. It's called a hypertension indicator. So you see the color-coded strip over here? That actually tells us where your blood pressure falls in the spectrum. So if it's a good reading or if it's a reading that you should be concerned about. So right here, it's right in the middle. It's a very good reading. It's in the good range. But we want to know that. You don't have to have any advanced medical knowledge. Veridian makes it very easy so that you can actually take that information and bring it to your healthcare provider. That is brilliant. Well, and today it's $5 off. So it's normally $44.95. We have it back for you for the weekend for $39.95. It's on 4 Flex, so it's $9.95 a month. Please think for you. Definitely get one of these home and have it in your house, but think of the loved ones on your holiday gift list as well. Absolutely. And you know, Carrie, it's so important that we actually continue to monitor this on a daily basis because, you know, a lot of times, again, 1 in 3 adults has high blood pressure in this country, 70 million Americans, and we we need to be able to be armed with that information to be able to do something about it, because they call it the silent killer for a reason. And this unit has so much information available to store in the memory to bring into our doctors, and clinically accurate device. Every household needs a blood pressure monitor.
Well, and it's pretty crazy to think about. And if we could show those statistics up on the screen again, I would love that, because it is mind-boggling to call it the silent killer and to see these statistics that I wasn't aware of, that so many of us are saying, oh my gosh, are you kidding me, about the number of us that are actually affected by high blood pressure. Can we put that up on the screen again? I would love to be able to share that with possibly anybody that's just tuning in. So listen to this. I mean, this is just mind-boggling. About 70 million Americans have high blood pressure. That's 1 out of every 3 adults. So how many of us don't even know this? Well, about half of the people with high blood pressure have their condition under control. So half of us do not. Again, terrifying. Nearly 1 in 3 American adults have pre-hypertension, which is high blood pressure numbers that are higher than normal, but not yet in the high blood pressure range. So what a great time to find out and start acting now. High blood pressure costs the nation more than $46 billion a year.
Carrie, look at the cost, and look at the cost to our loved ones. I mean, I talk to patients all the time. I want to show everybody again just how easy it is to use, because my patients are always wondering, what can I do about this? If they have a high reading in my office, I tell them, you need a wrist monitor at home, because if you're not monitoring this on a regular basis, that's where you're going to start running into some issues. So a lot of times what I'll do is I'll take this unit and I'll actually recheck the blood pressure right in front of my patient so that they see the readings actually match up. So you get the clinical accuracy with the Veridian wrist monitor, just like you would in the actual office. But what you don't get when you come to the doctor's office is you don't get to check your blood pressure in the privacy of your own home in a comfortable setting at the same time every day and store that information. Exactly. And you can see it's very comfortable, and just like that, we have a reading. And I want to show everybody again. Okay, we have our systolic blood pressure on top, diastolic, and this is just one reading, okay? So if I actually turn the unit off and let's see the memory again, the first thing that we actually see on the screen is an average of the last 3 readings. So again, we're starting to get a picture of that trend.
Right.
So you want that trend over time, because if you go to your healthcare provider, they don't want to know what your blood pressure is just in that instant, and that's not what you need either. You need to know what the trend is over time.
Exactly.
So with an ultra portable thin device like this that's clinically accurate, that you can take anywhere, you can throw it in your pocket, in your gym bag. I mean, this is something everyone should have.
I completely agree. It's very lightweight, and I want to show again what Veridian does, which I think is brilliant. The little color-coded here on the side, so that you can see. Actually, can you show mine where you did? You could. Yes. A lot of us look at it and go, okay, it's 120 over what? How does that play into my health? Basically, you can see if you're in a healthy range.
Exactly. It's called a hypertension or a high blood pressure indicator. So you don't need to have that advanced medical knowledge. You can just look at this, and you know, we all hear 120 over 80 is a good blood pressure, right? Well, right here we have that bar that tells us it's in a decent range. So we know that if we're starting to get up into the yellow or the red over time, that's something that maybe we need to be concerned about. We need to bring it to our healthcare provider so we can figure it out.
Absolutely. Well, it's on 4 flex of $9.99 for you today, with free shipping and handling and a $5 savings. Here again are the colors. You can pick this up in purple. You can pick this up in white. It's going to fit most wrist sizes because it's completely adjustable. And everyone can use this because it's one button. It's not confusing. You're not having to figure out how to program it. It's just you push the one button and you know what's going on.
Exactly. If it's easy to use, Carrie, and if it's clinically accurate, we're going to use it. You're going to use it at home, and that's what I recommend to my patients. You need something that's easy to use. If it's not clinically accurate, there's no use. This solves the problem for us.
So true. Well, a lot of you are picking this one up today, so we're thrilled for all of you that are getting this home. It's so empowering to know what's going on with especially when something is referred to as the silent killer. I mean, that is terrifying. 4 flexible payments of $9.99 with free shipping and handling. Matthew's going to stick around.